Hello, everyone. Welcome to episode 56 of the LUMP Basics or the LUMP TCM and Acupuncture for Beginners. Let's welcome for our opening salvo, Ma'am Needs You of Silang Cavite, certified acupuncturist. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, classmates. So topic for today is diagnosis of restlessness. Nice topic. Chest palpation. The process is palpate the area over the left ventricle of the heart called interior emptiness or deficiently in Chinese medicine. Nandiyan po yung drawing po. Pulse of the heart can be felt in this area, sometimes seen. Okay? The area reflects the state of Zong Qi or the gathering Qi. Okay? So there are key things to remember. Faint but clear pulsation indicates gathering Qi deficiency. Two strong pulsations indicate outpouring of gathering Qi. Example, a state of hyperactivity due to over-pushing oneself. Pulsation not felt indicates phlegm or a hiatus hernia. And the area below xiphoid process feeling full and painful on pressure indicates a full pattern. Okay, remember. So let's go to abdomen palpation. The abdomen is generally palpated in 5 areas: hypochondrium, epigastrium, umbilical area, lateral lower abdomen, and central lower abdomen. Okay. So hypochondrium, this includes the lateral side of the rib cage and area immediately below it. Yan po yung drawing. It reflects the state of the liver and gallbladder. Okay. Epigastrium, this area contained between the xiphoid process, costal margins, and the umbilicus. It reveals the condition of stomach and spleen. Okay, remember. Umbilical region, it is the area right around the umbilicus. It reflects the state of the kidneys, the penetrating and directing vessels. Okay? Umbilical area has a palpable pulse as well. So, pwede nyong kapain. Okay? Lateral lower abdomen, it is called Xiao Fu. It reflects the state of the intestines and the penetrating vessel. Okay? Yan po ang drawing. So the central lower abdomen, it is also called Xiao Fu. It reflects the state of the small intestine, kidneys, bladder, uterus, and liver. Okay? So let's go to Japanese hara diagnosis. Step 1, compare big and small abdomen. Yan po sa drawing, tingnan po ninyo. Big abdomen deficient, it is lung or spleen. Okay? Kapag small abdomen deficient, it is liver or kidney. Okay? Step 2, determine Nanjing abdominal diagnosis area. Sa spleen, it is the umbilical, CB7 or CB12. Sa heart, substernal, CB12 or CB15, I mean. Lungs, it is the right of the navel, right abdomen, okay? Liver, it is lower left the navel, left abdomen, okay? It's the kidney, subumbilical, CB7 or pubis, okay? Please screenshot. Thank you very much for your attention, everyone.
Thank you very much, Ma'am Needs. Up next is Ma'am Teresita Sumile for the wood element, the concept. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. The strength of the muscles depends on the yang of liver, while the endurance depends on the blood and yin of the liver. People with liver yang excess are very strong and can perform activities that require great strength. In people in whom liver yin and blood are insufficient, the muscles tire easily. If blood and yin are adequate, then one can do heavy work for a long time without weakening or tiring the muscles. Liver yang is associated with muscle tension. The higher the yang in the liver, the higher is the tension. The yin of the liver, however, makes it possible for the muscle to relax. However, tense a person is, he or she can relax when they get home, have a meal, unwind, and go to bed. But if their yin is deficient, their yang is farther away from their yin. So even if the stress factors are removed, the person still feels they are in a yang dominant state. Okay? Now, yang tension. The first tower diagram shows that yin is at a normal state and yang is increasing. And later, yang goes down to a normal state. So in this condition, liver yang excess and stress can relax and feel better when not working. Only a short time is needed for an excess to return to balance. Liver yang excess, tension during work can relax when not working. Stress-related symptoms occur during work, as in Monday morning, 10 a.m., and it will improve immediately on resting. So, in this condition, the symptoms are headache, asthma, eczema, nervous urination, nervous diarrhea, and vomiting. Now, the second illustration, i- at first, yin is deficient and yang is increasing. And later, yin is still deficient and yang goes down to its normal state. So, liver yang excess and stress but cannot relax when they stop working because the liver yin is still deficient. A longer time is needed to build up the deficiency. Liver yin deficiency always tense, cannot relax, or needs many days away from work in order to relax. Stress-related symptoms occur at the end of the work, as in Friday afternoon. They need to the entire weekend or longer to improve. Now, under this condition, uh, symptoms are headache, asthma, eczema, nervous tics, tremor, nervous urination, or diarrhea. Okay? Now, generally, those with healthy liver yin are quite laid back, relaxed people. Their liver yang is well controlled by yin, and it is only in extreme situations that they feel any tension at all. But those with liver yang deficiency thrive or stress, work, and certain level of stress provide them with the yang they are missing in order to generate the yin or qi to move their energy flow. As long as their work keeps them active and happily occupied, it is therapeutic for them, but in a situation where they find the work difficult or unfulfilling, this can create a block in their free flow of energy and cause much internal stress, as they have insufficient yang energy to move these blocks. They will internalize their stress because the yang is too low for them to be physically restless. They will look very calm through periods of stress, but will not feel calm. Their general muscle tone will be rather flaccid, but one part of their body will be very tensed. That is the area that suffers the stress and where the energy, blood, body fluid is stagnating. If it is the stomach, They could suffer from pain, hyperacidity, and ulcers. If it is the skin, they could have eczema. If it is the blood vessels, they have they may have high blood pressure or headaches or mental depression with suppressed aggression. Okay? Liver yin and yang deficiency. Here, the patient is always tense and stressed. Everything is too much for them, even if they do not have to do anything. These muscles are weak but tensed, with nervous tremor or tics. The blood pressure can vary greatly between high and low, which makes it difficult to give them medication. Treatment for stress and tension. General points, liver 3, lung 7, and do 20. So liver young excess. Sedate, gallbladder 38, indirect sedation of coupled young organ. Spleen 6, descending technique. As liver young always rises, this will help move it downwards. Some tranquilizing points, meditation or relaxation, and deep breathing. And the last is avoid alcohol and sour foods. In liver fire, same therapy as above. Instead of sedation of gallbladder 38, give liver 5 the low point. If necessary, add gallbladder 40 sedation, which is the yon source point. Now, in liver yin deficiency, liver 1, own element point, or liver 5, the loop connecting point. Tranquilizing points. Liver yin deficiency often goes together with kidney yin deficiency. If kidney yin is deficient, then substitute liver yin tonification with kidney 7. Then liver yin deficiency could also occur with blood deficiency symptoms. And in these cases, points for liver blood tonification should be given. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Next, we call on Ma'am Lynn Galarita of Quezon City for wood element diseases. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So this is the continuation of our topic yesterday, wood element diseases. Magpapatuloy pa rin ito tungkol sa headache. So for today, we have here a clinical example of a patient suffering from headaches. Our patient is a 32 years old male who is a young carpenter who had been having a bilateral temporal headache for the last 3 to 4 years. The headaches occurred quite often, nearly daily, and mostly on working days in the afternoons to evenings. They started slowly around 3 p.m. and developed into a severe exploding pressure by the time he got home, which was around 6:30 to 7 p.m. He could stop the headache occurring in the afternoon if he ate something. However, he would start vomiting once the pain became worse, and then he could not eat or even take a painkiller. He was much better during the holidays. When the doctor asked him about his eating habits, he said that he had cornflakes with milk for breakfast and started work early. His work was very physical and mostly he did not bother with lunch. If he had time in between, he would have a packet of crisps and a coffee. He liked having a warm meal in the evenings, but if he had a headache, he could not eat. He had lost much weight recently and was feeling rather weak. His acupuncture sessions were usually after work and on his way home, so he often came with headaches and vomiting. Though he was rather pale, one could notice that he often bled when the needles are removed and that the bleeding did not stop easily. Okay. So after listening to his story and witnessing his headaches, the doctor became convinced that it was stomach related. He had very little to eat in the day and had a very physical job and did not eat lunch because he was sitting on some rooftop doing the woodwork. His headache occurred in the forehead region, both sides, and that was the stomach and the large intestine area. He could not he could stop the headache progressing if he ate something early enough. If he missed that time, then his stomach yang would begin to rise, making the headache much worse and with vomiting when the stomach became hyperactive. It was then too late to eat. Here we have a tower diagram how the headache progresses. So when the stomach is empty and starting to feel hunger, stomach yang is still on the normal level, but stomach yang is deficient. Pag hindi pa rin siya kumain, stomach yang rises and then headache and vomiting. The patient was advised that he had to eat better and also before started vomiting. He needed to eat lunch and even something around 3 p.m. so that his stomach would not be empty. Sandwiches with meat, cottage cheese, and a banana were easy foods to keep in a backpack that he could keep near him whenever he was working. Milk drinks instead of coffee would fill and nourish him better. He was not happy, but decided to give it a try for a week. He had no headaches or vomiting at all for that week. He also felt much better and stronger in himself. In his acupuncture treatment, the doctor added Liverian tonification. There were two reasons for doing this. First, liver stores blood within vessels, and a yin deficiency causes problems with coagulation. Second, Liverian nourishes the stomach yin and controls stomach yang. We have here a diagram how the wood element or the liver over controls the earth, which is the stomach and the spleen, or the stomach particularly here. So if liver yin is deficient, it will cause over controlling the stomach, and then so that the stomach yang rises, thereby mayroong mga headache with symptoms, other symptoms like vomiting. Okay. The treatment for this patient was the local point, which is extra point 2, the Taiyang on both sides. The distal point, which is Li4, the symptomatic point, GB20 and pericardium 6. The influential point is REN12 for all young organs. And energy balancing points were also used, which are liver 1, the wood point, which tonifies yin. Spleen 21, which is the major loop point of the spleen, which tonifies yin from the yuan source point. And stomach 42, the sedation. For sedation, this is the yuan source point that sedates the yang. Before making the diagnosis, the doctor treated him thrice without success. After seeing him through 2 headaches, the treatment was changed to the one mentioned above, and he was treated once a week, 4 times in all. And he has no headache for now. Okay. That's all for headaches. Thank you for listening.
Thank you very much, Ma'am Lynn. Let's now call back Ma'am Teresita Tumile for the metal element, the concept. Good afternoon ulit, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. We are now on the metal element, the concept. Now let's talk about lung nourishes skin and body hair. We have already discussed the lung function of sending water to the skin surface and open-close function of the skin earlier in this chapter. We also discussed the different skin types such as thin and dry skin, thick and oily skin. The author now would also like to mention mixed skin, which could be either oily skin in the face and dry fish scale type skin in the legs, or oily and dry skin in different parts of the face. The first indicates poor distribution of fluid in the triple warmer. The second is because of spleen chi deficiency. Now we have here a diagram showing the triple warmer. Now the organ belongs to the upper warmer are the heart and lung. In the middle warmer, the spleen, stomach, liver, gallbladder, small intestine, and large intestine. In the lower warmer, the kidney, excuse me, urinary bladder, and reproductive organs. Okay? Treatment. The function of the triple warmer is to distribute heat and water equally in the three warmers. If one warmer is dry and the other is moist, this could be because of Qi deficiency in the triple warmer. So the treatment is tonify triple warmer Qi by using UB22, the backshoe of the triple warmer, UB39, the lower C point of the triple warmer 5, the loop connecting point, then tonify yin of deficient warmer. Example, for dry skin on legs, tonify kidney yin. If within one area there are oily and dry patches, this indicates poor circulation of dampness on the surface, or spleen chi deficiency. The treatment is tonify spleen chi, UB20, backshoe point of spleen, spleen 1, the wood point or the grandmother point, and stomach 40, the loop connecting point. Now let's talk about the 5 elements and their relationship to the skin. The relationship of the 5 elements is such that every other element is interrelated to each other. And when one element is imbalanced, another is affected by that change. The lung, the skin, too, are highly sensitive to interior changes in energy, as much as to exterior climatic changes. The diagram below shows the relationship between the other elements and the lung. So we have here a diagram showing a relationship with 5 elements with the lung, and this can be fully explained in the next slides. Next slides, please. Relationship between lung and earth. It is said that lung nourishes skin and body hair. The lung gets nutrition from its mother, the spleen. So, when the skin lacks nutrition, it makes sense to see if the spleen, the mother, has enough nutrition to send to the sun. If a thin patient has a thin and wrinkly skin, it could literally be filled up by damp-producing foods. A 1/4 liter of buttermilk a day keeps the wrinkles away. Wow. If the skin is not well nourished, the reason is poor spleen nutrition. A thin skin is also sensitive to pain or to the sun. You will know these patients after their first needle, and so will be the other patients conditions in your waiting room. Thick and fatty skin, as in a patient with acne vulgaris, occurs when there is excessive dampness flowing in from the spleen. Dispersing spleen 9 helps, but it is more important to completely avoid damp-producing foods like milk and fatty foods, refined sweets and carbohydrates, and excessive cold and raw foods. The skin gets its tone from the spleen function or chi. It is the connective tissue that adheres the skin to the muscles. And in spleen chi deficiency, the skin hangs loosely from the muscles. To improve this, one should consume foods that increase spleen chi, which are mainly wholemeal grains, cooked and warm food and drinks. It is important that the patient does not consume large evening meals so as not to cause strain on the spleen function at its lowest energy time according to the organ clock. Plum blossom tapping could be used as local treatment to firm the connective tissue. Now let's talk about lung and fire relationship. The yang of the heart and small intestine and the triple warmer warm also the skin and improve blood circulation. So if the heart and small intestine yang is deficient, the skin is pale, or there can be a marbling effect on the skin between pale and pink, and skin diseases worsen in cold weather. When the heart, small intestine, and the triple warmer have excess yang, this could cause yang diseases of the skin, such as inflammation, burning, and urticaria. Therefore, in yang diseases of the skin, it is necessary to make sure that the fire element is not the cause of the heat. And if so, points SI8 and triple warmer 10 sedation points should be used with sedation technique. The patient should avoid caffeinated drinks and red meat, as this could increase heart yang. Okay? Now let's talk about lung and water relationship. The kidneys store water for the body and irrigate it. If the kidney yin is deficient, they will draw water from the mother, the lungs. This occurs in menopause and in other situations where the body turns dry. If this happens, the skin should drink more water and eat salty foods to hold this water in the body. The tonification point of kidney 7, is not ideal for use in this situation because its source of yin is the lung. So, point kidney 10, which is the water point of the house element point of the kidney, gets its energy from the yang of the large intestine, the opposite side of the organ clock, and is the best point in this case to tonify kidney yin. Okay, now when kidney yin function is compromised and it does not eliminate sufficient water, there is water retention and edema in the body. This will also affect the lung and the skin. In this case, kidney function should be tonified with points UB23, needle with cupping, UB58, low point to sedate yin and tonify qi. Okay. Next is the relationship between lung and wood. Liver and gallbladder qi generates internal wind, which is important for free flow of blood, energy, and body fluid. Qi deficiency causes stagnation and block in this free flow, which there is liver yang excess or ascending liver wind. This could cause wind symptoms in the skin and in the respiratory system, such as sneezing, irritation, and bronchial spasm. If this occurs, it is a sign not only for the liver or gallbladder to ascend wind, but also that the lung yin is deficient and it is unable to control the liver cycle, and that the gallbladder is counterpowering the lung counterpowering cycle, page 207. In this case, point gallbladder 28 sedation should be used together with wind eliminating points for the lung and skin wherever there is itching, and with the wind elimination sedation technique. Also, points lung 1 and 8 should be given in order to tonify lung yin, so it can control the gallbladder and liver yang on the controlling cycle. In liver blood deficiency, also heart blood deficiency, since heart synthesizes blood and liver stores it. There is less nutrition and moisture all around. This also causes dry, poorly nourished skin without luster, dull body hair, and with a tendency to injure easily and heal poorly. Points used are REN 14, UV 15, UV 17, gallbladder 39, and iron supplements should be used to build up blood. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We call once again Ma'am Lynn for blood.
Good afternoon, everyone.
Good afternoon po ulit.
So we're still on the vital substances. After Chi, we now discuss blood. This is just a review for all of us. So what is blood? In TCM, it's not the same as the concept in Western medicine. Blood is the red liquid circulating in the vessels with Qi. It nourishes the body and Shen, and it is inseparable from Qi. Okay. Blood is a form of Qi, a dense and material one. Qi infuses life into blood, and without Qi, blood would be inert. Blood is derived mostly from gu qi, or food, produced by the spleen. Spleen pushed food qi upwards to the lungs, and then the pushing action of the lungs sends a blood to the heart, sends it the gu qi to the heart, where it is transformed into blood. Blood moistens and nourishes the body, which complements the nourishing action of qi. Blood provides the material foundation for Shen, as blood is part of Yin and it houses and anchors Shen. So if we have problems with blood, magkakaproblema din tayo sa Shen. Okay. Here is the flow diagram of how blood is created. It involves the organs, kidneys, stomach and spleen, lungs, and the heart. So we have two sources of blood. One is the pre-heaven source of blood, which is the kidneys. From the kidney, it produces the marrow. And the yuan qi from the kidneys acts on the marrow to produce blood. The second source is the post-heaven source of blood, which comes from the food and liquids that we take. It's digested in the stomach, transformed by the spleen as gu qi, and sent into the lungs, then pushed to the heart to produce blood. Okay. So for the functions of blood, first, blood nourishes the body. Blood is circulated by heart, which governs blood. It circulates around the body, carrying nourishments to all organs, muscles, tendons, and tissues. And the qi helps blood to do this. Second function is it moistens the body. The liver blood moistens the eyes and sinews, the skin, and hair. Heart blood, on the other hand, moistens the tongue and nourishes the shen. Blood houses the mind or the shen. It helps anchor the mind, helping us to have clear thought. So when you are blood deficient, you experience anxiety and unclear thinking. Okay. So what happens if we have problems with blood? First, we have here blood deficiency. This can be due to not enough qi to move blood, or the blood is not being produced. Usually, we relate this to the spleen's inability to move good qi for blood production. So wala rin tayong kinakain, walang magagawang good qi yung ating spleen. Another cause could be excessive bleeding, which could also lead to blood deficiency. Okay. Among the clinical manifestations of blood deficiency are pale complexion, pallor, pale lips, pale, thin, and dry tongue, insomnia, dizziness, vertigo, blurring of vision, palpitations, numbness of hands and feet, fatigue, pale face. In blood deficiency, it affects the whole body. So the tongue will look pale with thin coating and the pulse will be thin. Okay. Another problem would be blood stasis. This happens if qi is weak or stagnant, then it may fail to move the blood. So qi stagnation could lead to blood stasis, and this may develop tumors. Blood stasis can also be caused by trauma. So among the manifestations, clinical manifestations of blood stasis are the following: the sharp pain that is fixed in location, dull complexion, tumors, cysts or swelling of the organs, mostly of the liver. So in blood stasis, the tongue is purple and or with purple spots. The pulse will be deep, choppy, maybe a little wiry. So another problem with blood is heat in the blood. This usually results from internal heat generated by disharmony of other organs, usually the liver. Among the clinical manifestations are the following: reckless bleeding, like hemorrhage, bleeding between cycles, and others. And there is also restlessness and irritability. Heat in the blood also presents with skin problems, a deep red tongue, and a rapid pulse. This is all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. We now call back Nits Yu, certified acupuncturist of Silang Cavite, for the water element. Good afternoon again, Ma'am.
Good afternoon, Doc Hector. Good afternoon, everyone. So the topic for today is water element, premenstrual cycle. Tension pala. So some women may have excessive stagnation of dampness in the second phase of their menstrual cycle. This could manifest as severe premenstrual tension with symptoms such as edema, breast distension, heaviness and lethargy, and weight increase. Okay. This may retard the function of many organs and cause constipation, less urination, dullness and depression, and strong food cravings. Okay. The patient will eliminate great quantities of stools and urine when the period begins and feel lighter and better after menstruation. Okay. This is a manifestation of stagnation of dampness in the kidney, as it is in the organ that is related to the reproductive organs, and to the spleen, as this is the organ that circulates dampness in the entire body. Okay. Let's go to the kidney spleen qi deficiency. This could also delay the menstrual bleeding as the function of elimination is poor. It occurs because the second phase is too long, okay? There could also be a blood stagnation in the uterus. This may manifest in symptoms such as premenstrual lower abdominal pain and backache, pressure on the urinary bladder, irritability, and severe dysmenorrhea with nausea, dizziness, and slow starting of menstrual bleeding, okay? The blood is clotty and dark on the onset of bleeding, which is also the time of the maximum pain. On the second day of menstruation, when the bleeding is more red and fluid, the pain improves as well. This is an imbalance of urinary bladder because of its direct association with the uterus and of the liver, as this is the organ that stores and releases the blood for the entire body. Okay? So let's go to urinary bladder, uterus, liver blood stagnation. So generally speaking, this does not cause a longer second phase, but causes problems starting to bleed. Women complain that bleeding begins with difficulty, occurs at intervals with dark, clotty bleeding. They could also suffer from premenstrual liver headaches, okay? So here, kidney, spleen, and dump stagnation. Symptoms nito, premenstrual edema, breast distension, heaviness, and lethargy. There is less urine, constipation, dullness, and food cravings. The weight increases before period. There is increased stool and urination with menstruation. It feels better kapag natanggal. And the tongue is large with teeth marks. So the treatment you're going to use is bladder 20, bladder 23, which is the Bakshu points, needle and cupping. Bladder 58, stomach 40, the Luo points. LI4, triple warmer 6, stomach 25, which is the constipation points, remember? Spleen 9 is the diuretic point. So more sport, closer to period. Yun yung advice. You should reduce intake of refined sweets and milk products, okay? So on the other hand, urinary bladder, liver blood stagnation, symptoms are premenstrual irritability, mood swings, depression. There is coldness, poor concentration, dizziness, pressure on bladder and rectum. There is dysmenorrhea before free flow of bleeding. Begins with dark, clotty bleeding. Pain eases when blood starts flowing freely. The tongue sides and there is black back and the back is purplish. Yung sides po, tsaka yung back purplish ang color. Okay? Treatment you're going to use is bladder 18, bladder 28, which is the Bakshu points, paravertebral tapping from L4 to S4, bladder 58, GB37, which are the low points, spleen 8, symptomatic dysmenorrhea, use LI4, the great eliminator, use stomach 40, which circulates the dampness. So advice is more sport, closer to period, okay? So let's go to premenstrual tension. Some women may have excessive stagnation of dampness on the second phase of their menstrual cycle. This could manifest as severe premenstrual tension with symptoms such as edema, manas, breast distension, heaviness, and lethargy, and weight increase, tumataba. This may retard the function of many organs and cause constipation, less urination, dullness, and depression, and strong food cravings. Okay? The patient will eliminate great quantities, marami, quantities of stools and urine when the period begins and feel lighter and better after menstruation. Okay. This is a manifestation of stagnation of dampness in the kidney, as it is the organ that is related to the reproductive organs, and to the spleen, as this is the organ that circulates dampness in the entire body. Okay, remember po.
Thank you very
So,
much, Needs.
Thank you po, Doc.
Oh. Let us now call once again Mom Lynn Galarita for the Meridian theory.
Good afternoon ulit, Dr. Hector. Good afternoon, everyone. We're on the third installment of the due meridian extra meridian. Okay. It's also called the due vessel. Considerations of the due vessel also involve the region associated with the MBW35 or the Watu-Jachi points. As noted earlier, these points are actually located on a collateral of the due vessel. Observation of the condition of the skin over the spine at the level of each back transport point or the backshoe points can provide us clues to the condition of the chi dynamic in the organs. In general, dryness indicates deficiency, while small red macules or raised papules indicate heat or stasis of blood. As to the pulse palpation in this area, there are no special pulse consideration for palpating pulses along this vessel. Okay. So let's start palpating and pressing the points and feeling the body surface. In considering the 12 regular channels, palpation was discussed only on the distal limbs. For the Ren and Du vessels, however, palpation of the pathways on the body trunk can provide important diagnostic information. In general, changes found at Du vessel points should also be considered in the context of the organ associations indicated by the nearby back transport points or the backshoe points. For example, tenderness or a thickening between the vertebra found at GB12 might indicate a pathodynamic of the upper burner in general, or alternatively, a specific condition affecting the organ. As bladder 13, is on the same level as GB12. It's also found at the level of thoracic vertebra, the third thoracic vertebra. The first area to consider when palpating along the Du vessel is the head. If tenderness or pain is found when palpating the area between GV19 and GB21, this indicates an overall lack of smooth circulation in the Du vessel. The cause may be stagnation, deficiency, or cold. Symptoms might include low back pain, neck pain, headaches, dizziness, emotional conditions, or even insomnia. Okay. Here's a picture of where the GB points are located. So, okay. GB20 is on the midline between using the ear apex as the midpoint, using the ear apex as our landmark sa pinakagitna po ng ulo. So GB21 is 1.5 tune above GB20. Okay. Soreness or a thickening of the intervertebral space between GB14 indicates blockage of the yang channels. While this is most commonly seen in exterior wind-cold patterns, there is also a tendency for this area to become tender in cases of chronic cold accumulation in the collaterals of the Du vessels. Symptoms associated with this pattern may include back pain, stiffness, or a cold sensation in the body. Tenderness at GB12 often indicates qi deficiency in the upper burner, which includes both lung qi and the gathering qi. Okay. Palpated changes around GB11 and GB10 and GB9 generally follow two patterns. If there is tenderness in the area, this generally indicates external heat or a combination of heat and cold, usually in the heart, pericardium, or stomach. If, on the other hand, the area is swollen or has nodules, which is not necessarily red, this indicates a more severe case involving fire toxin in the internal organs. Note that the nodules may be along the top of the vertebra when palpating the dew vessel, while tenderness is generally found between the vertebrae. The area around GB8, GB6, or GB4 will have pain or very small nodules along the top of the vertebrae in the presence of back pain due to cold or blood stasis in the dew vessel. The sacrum will present with a variety of palpable changes in the presence of gynecological problems or emotional conditions. This includes insomnia. Due to constraint, this pattern often involves a deficiency of the young. So here, if we have tenderness around GB19 to GB21, where it's only tender with significant pressure, this could mean chi stagnation in the dew vessel. If there is pain, which is painful with light pressure, it could mean cold or blood stagnation in the dew vessel. As for GB14, if we can feel soreness, this means exterior cold condition or chronic blockage of multiple young channels affecting the dew meridian. Okay. If there is tenderness in GB12, there's an upper burner excess condition, which includes the heart or the lungs. Okay. Tenderness, also, ano ba to siya? GB, this condition of tenderness in this area could mean external condition, often heat, affecting the pericardium or the stomach. Okay. So if there is swelling around GB9 to 11, it indicates excess heat affecting internal organs, the heart, stomach, or the pericardium. If you can feel nodules around GB4 to GB8, this could mean chronic heat conditions in organs often involving fire toxin. If we could feel that it is grainy, there is chi stagnation, often liver overacting on stomach type patterns. If there is pain in around GB4 to 8, it indicates chi deficiency or cold or a lack of circulation in the lower burner. There are nodules, it means cold accumulation in the dew collaterals, often with back pain. If grainy, this could mean acute chi and blood stasis in local collaterals or organs of the lower burner. Okay, that's all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come finally to the last topic for this afternoon, still on chronic fatigue syndrome. This time we talk about infire. The concept of infire was introduced by Li Tongyuan, in his book, Discussion of Stomach and Spleen. Dr. Li says that as a result of improper diet and overwork, the original qi or yuan qi becomes weak in the lower burner, and the stomach and spleen are weakened in the middle burner. This causes the patient to feel tired and often cold. When the patient is also subject to emotional stress, the minister fire is stirred and it becomes pathological, and it leaves its place of concealment in the lower dantian. So here you could see how yin fire is illustrated in the following figures. So every time there is stress, okay, there is harassment of the heart and pericardium because of the stimulation of the pathological minister fire. And as a result of this, there will be depression, feeling of heat in the face, and red cheeks. Okay. And the pathological minister fire actually displaces the yuan qi. So this leads to yuan qi deficiency, which will later on lead to deficiency of the stomach and spleen. That's why the patient would feel would have exhaustion and feeling cold. And of course, if you have deficiency of stomach and spleen, this will lead to yuan qi deficiency. The second chapter of Book 2 of the discussion of stomach and spleen says, irregular diet and exposure to hot and cold climate injure the stomach and spleen. When the qi of the stomach and spleen declines, the original qi or the yuan qi becomes deficient. And so the fire of the heart becomes excessive by itself. This fire of the heart is called the yin fire. It arises from the lower burner and it flows up to the heart. The heart does not govern directly, but it is deputized by the minister fire. The minister fire is the fire of the Pao Luo, Dan Tien, in the lower burner, and it is a thief of the original or yuan qi. This fire and the original qi cannot occupy the same space. When one is victorious, the other declines. When the stomach and spleen are deficient, their qi descends to the kidneys and yin fire overcomes the earth. As yin fire rebels upward, there is breathlessness, mental restlessness, feeling of heat, overflowing and big pulse, headache, and thirst. The skin cannot tolerate wind and cold, and there is alternation of feeling of heat and cold. Qi of stomach and spleen infuses downward so that food qi or ku qi cannot rise and float. How do we treat this condition? One must treat it with pungent, sweet, and warm herbs to tonify the center and raise the yang, together with some sweet and cold herbs to drain the fire. Exhaustion and depletion should be treated with warm herbs. Warm herbs can eliminate heat. One must not use bitter, cold herbs that would damage the spleen and stomach. As the minister fire and the original qi reside in the same place in the lower dantian, the pathological minister fire displaces and weakens the original qi even more. Dr. Lee said that the pathological minister fire becomes a thief of the original qi. The arousal of the pathological minister fire upwards causes some heat symptoms in the upper part of the body, such as red face and mouth ulcers. This he called yin fire. Yin fire is neither full heat nor empty heat, but it is simply a different kind of heat that derives from deficiency of original qi and of the stomach and spleen. It follows that yin fire is not treated by clearing heat or draining fire, but by tonifying the original qi and gently clearing the heat upwards. Thank you everyone for joining, and we hope you can join us again next time. Thank you.